In the Oregon Genetics Program, we strive to improve the health of all Oregonians and their families. We support evidence-based use of genetic and genomic applications, and our mission is to promote the health, well-being, and quality of life for our population using genomic interventions and the public health model. Next slide, please. One of our overarching goals is to safeguard the public from detrimental use of genomic information while promoting applications where there is clear benefit. To do this, we use a three-pronged approach of surveillance, education, and policy. Our program collects population data that allows us to identify current gaps in knowledge and services and opportunities for change. This information helps us develop our strategies and create buy-in when we educate stakeholders about prevention, early identification, screening, treatment options, and referral for genetic services, which include genetic counseling and genetic testing. Next slide, please. Having a BRCA mutation will greatly increase an individual's risk of developing breast, ovarian, and other BRCA-related cancers. Using genetic screening applications, such as the ones that Dr. Corey mentioned during his talk, will save lives. Next slide, please. In Oregon, we have almost 3 million adults, both males and females, in the population. We estimate that about 20,500 Oregonians are BRCA carriers, and approximately 154,000 appropriate candidates will need to be tested in order to identify these carriers. Next slide. In 2008, 840 Oregonians received genetic testing for BRCA gene mutations by Myriad, the only company in the U.S. who conducts this clinical test. In the middle bar, we see that less than half of the BRCA tests were conducted in a facility where a trained genetic specialist was located. This may cause variation in the quality of genetic counseling and the decision-making process of the patient before and after testing. If we look at the third bar, we can see that the Medicaid population makes up just a fraction of those tested and highlights a large disparity. So these multiple data sources tell us that we have a huge opportunity for screening through the use of genetic services, and that some populations are currently experiencing noteworthy disparity. Next slide, please. While our work largely addresses access to genetic services, it's important to note that cancer prevention, detection, and treatment involves multiple approaches that requires a broad network of providers, agencies, and partners working together. I included just a few of our partners in this diagram to show how collaborations can affect one focus area or span into two or more areas. Our outreach into the Ashkenazi Jewish community, for example, allowed us to conduct educational activities within a targeted community, while our collaborations with Oregon Medicaid ultimately led to activities in all three of our focus areas. Next slide. Surveillance is the foundation of our program. We have many data sources, including those listed here. Our program acts as a clearinghouse. After we gather the data from multiple sources, we analyze what each says to build a fuller picture of the situation and identify gaps in knowledge and services. Through this, we are able to use our data to directly support our policy and educational activities. Next slide, please. We have three main educational goals, and we tailor our messages to fit with the different populations we work with. Here, I'd like to focus on our recent work with the local Ashkenazi Jewish population. Last spring, we conducted an Ashkenazi Jewish BRCA awareness campaign, which included a 4-hour training session with our staff, a local cancer geneticist, and a dozen Jewish women to increase their knowledge of BRCA mutations. We presented information about BRCA mutations and the implication for the Jewish community, given their increased risk of having a deleterious mutation due to ancestry. We reviewed the information packet we provided and engaged in a personal discussion of the impact of their experiences, shared stories, and gained knowledge. Since then, attendees have formed their own work groups to continue communications about BRCA throughout the Jewish community. We also work with primary care providers, OBGYNs, cancer specialists, and other healthcare providers to support them in making appropriate referral to genetic services. And in 2010, we surveyed the top Oregon health insurance companies, private, public, and self-insured, and found inconsistencies in their policies for covering counseling, testing, and follow-up care. In the near future, we'll be working more closely with health insurance companies in Oregon to ensure that Oregonians have consistent and quality care that they can depend on. Next slide, please. We support the use of evidence-based recommendations, the appropriate use of genetic services, and the licensure of genetic counselors. In 2011, we worked with Oregon's Medicaid program, and Medicaid in Oregon now covers BRCA genetic services for those with and without cancer, matching current evidence-based guidelines. We will study future Medicaid data to monitor the number of BRCA tests paid for and how quickly the socioeconomic barrier to appropriate services may change. We will also be promoting the use of evidence-based guidelines, such as the National Comprehensive Cancer Network guidelines and the USPSTF recommendations in our conversations with leading Oregon health insurance companies and healthcare providers. Next slide, please. From these projects, we have learned that what gets measured gets done. Calculate your baseline data and use it to focus your activities. We use Healthy People 2020 targets when available to reassess our data over time. This helps identify gaps and unmet needs as well. Multiple data sources are needed. Decisions are only as good as the data that they were based on. Data from multiple sources can give you a more accurate understanding of the situation. For example, we use the data from the Oregon State Cancer Registry, Oregon Census, and the literature to estimate the incidence and prevalence of BRCA mutations in Oregon, as well as the number of adult Oregonians who may benefit from genetic services. Multiple partners are needed as well. From funding to creative thinking, including a diverse set of partners will help with limited resources. In addition, multiple and comprehensive approaches will get the job done. Solutions that are multi-pronged will more fully address the issues at hand. We work with patients, providers, and health insurance companies to promote the use of evidence-based guidelines in referring for genetic services. Next slide, please. We will be working with the Oregon State Cancer Registry to send educational letters to cancer patients who may have a BRCA mutation, and we will be sending these educational letters to their doctors simultaneously. We hope that this will increase the likelihood of genetic services being discussed during the next patient visit and provide them context for the discussion of referral. We will also discuss the Tier 1 evidence-based genomic applications with health insurance companies. We'll be sharing cost-effectiveness studies and emphasizing the potential for client support. We will also continue collaborating with our many partners in the field of cancer, including the Oregon Partnership for Cancer Control, the Oregon Comprehensive Cancer Control Plan, the Breast and Cervical Cancer Program, the Oregon Cancer Registry, and many others. As I stated before, while our work focuses on increasing appropriate referral for genetic services, it's important to note that cancer prevention, detection, and treatment involves multiple approaches, including genetic services, and all approaches require a broad network of providers, agencies, and partners. Next slide. Thank you so much for listening. Please feel free to contact any of us if you have questions about this presentation or our program.